Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and today I'm actually going to start doing something that's a little bit uncomfortable for me, and so I just wanted to put it out there so I'm going to do a presentation, and I'm going to use our smartboard to help facilitate the conversation that I'm going to have today. And what I wanted to do is really start to talk about Orthodontics 101, and Orthodontics 101 to us is what you would want to know if you or your child were the patient. And so the first question that we're going to answer is conventional orthodontics serving the needs of our patients today? And what that means is, are we, as orthodontists in the orthodontic profession, is traditional braces that we've been using for years serving the needs of our patients? And I kind of have an answer, and I'm going to probably tell you that in my mind and in my estimation, it's not. And so one of the things that we're going to do is I'm going to talk about this example. And this example is really important because this example, here are two sisters. They're twin daughters. They're twin sisters. And the difference in what's going to happen is both of them are going to go have orthodontic treatment done. And one of them is going to have extractions and one's not going to have extractions. And so in this video, what I'm going to see is, can we predict which of the two girls had the extractions? And so what we do is, here is their pre-treatment. This is before they've had orthodontic treatment. And one of the things as an orthodontist that I want to kind of like look at is, what's really important is the profile. And what I always tell parents is what we're looking for is, if I drew a dot on her chin and a dot on her nose and I connected to the two dots, what I want is the upper lip and the bottom lip to be as close to that line as possible. And so what I would tell you, if you were in the office today, that her upper lip position and her lower lip position looks really good. And so what we would say is, your daughter has a non-extraction profile. What that means is that we want to keep the upper lip and the lower lip as close to that line as possible. And so that is our job. So that's what we're going to try to do. And so the question is, well, how would you not do that? So we want to maintain this. And so the question is how would you not maintain it? And one of the ways you would not maintain it is if you actually extracted teeth. And so what we want to do is we would identify these girls as girls that we wouldn't want to do extraction therapy on. And the reason is when the extractions are complete, now the question becomes, did this girl have the extraction or did this girl have the extraction? And so we really can't tell from this picture, but if we go to the profile picture, what you start to see is, you can see that the girl over here had the extractions compared to her sister. And so if we drew those same dots again, if I drew a dot there, and I connected the two dots, like that and like that, what you can see is the upper lip and the lower lip moved away from the line. So this girl, this daughter, this girl's going to end up, when she's in her 20s and 30s, looking much older than her sister, because as we know, as we age, our nose and our chin get bigger. And so what this tells you is that the number of teeth that a person has and the position of the upper teeth actually make a difference in the facial outcome of our patients. And so when we look at this, we would say that this is a girl that's going to have a smile that she grows into because she has fuller lips, and as she gets older, she'll just grow into her smile. This is a girl that has straight teeth just like her sister, but she's going to grow out of her smile as she gets older. And so one of the things that we're really passionate about is really creating this smile that children are going to grow into. And the thing is this is not really a question about just extractions, should we extract or not extract, but because there's ways for us to do this as orthodontists where we don't have to pull teeth. And so the message I want to get to you is, and this is the thing that you want to ask, is pulling teeth out going to make a difference in the facial outcome of your child? And that's the critical question. And if it is, then you want to do something, you want to do orthodontic treatment where that doesn't occur. And we have different ways that doesn't occur, and that's what we're out to achieve in our practice. And so if you have any questions about the consequences of possible extraction therapy on your daughter or your son, or even on yourself, come into our office. We'd love to give you a free evaluation and see if we can make a difference for you as we do your orthodontic treatment. Have a great weekend, and we'll see you next week at our next Friday Focus.